Now to a fight between hospitals and the Oregon Health Authority over the handling of civil commitment cases. We've talked a lot about civil commitment over the last month. That's when a person has a severe mental illness but denies treatment and they're forced to get it anyway. Well, Legacy Health, Providence Health, and Peace Health are now suing the OHA because the state hospital has all but stopped taking civil commitment cases. Reporter Evan Watson explains why hospital systems are frustrated that they're now picking up the slack.
3 Oregon hospital systems are suing the Oregon Health Authority, saying the state is forcing them to provide long-term mental health care when their hospitals just aren't built for that.
Our community hospitals that provide acute inpatient treatment for behavioral health are meant to stabilize individuals, and then once they're stabilized, move them to the next layer of care that they need. When we can't do that, those beds that are not accessible for people who are in an acute crisis.
Melissa Eckstein is president at Unity Center for Behavioral Health.
We're seeing a tremendous backup, meaning we're not able to get people into the services that they need. We're starting to see individuals staying longer in our emergency rooms when they're trying to access behavioral health services. We're seeing people not being able to get into outpatient services as easily as they were maybe a couple of years ago.
The Oregon State Hospital stopped admitting most civil commitment patients in 2019, even though about 500 people are committed in the state each year. As a result, the number of civil commitment patients at the state hospital has dropped from hundreds of people to about a dozen. OHA has followed federal court rulings to prioritize mental health patients who are facing criminal charges or considered guilty except for insanity. But hospital leaders say this practice violates the civil rights of commitment patients, leaving hundreds of people in community hospitals that aren't designed for long-term care.
We want to end the cycle of people not being able to get the care that they need in the moment that they need it, and to advocate for having a full continuum of care regardless of where people are in their crisis.
In a statement, the Oregon Health Authority said it's focused on the care of the hospital's patients and supporting them on their road to recovery as they search for a new path forward. OHA did not comment on the lawsuit. The suit claims the state has known for years about OHA's failure to provide, quote, appropriate and legally required treatment to civilly committed individuals, following a 2017 study that found limited acute care beds and emergency room backups. A civil commitment can last up to 6 months. The Providence, Legacy, and Peace Health hospital systems want a federal judge to rule that OHA's practices towards civil commitment patients are unconstitutional and for the state to assume care of long-term civil commitment patients.
Evan joins me now, and the state hospital story is the gift that just keeps giving.
That's right.
So how many patients are in these local private hospitals?
Right, so we had Providence, Peace Health, and Legacy, and I asked them that. I said, so how much are you dealing with? What does this look like on an annual basis? They gave me an estimate of around 200 civil commitment patients that those 3 hospital systems are working with each year. And again, a civil commitment can last up to 6 months, 180 days. So those are beds that would be occupied for a long amount of time, potentially taking that away, which is their concern leading to this lawsuit that was filed recently.
And then just like with the aid and assist, I'll bet there's people that would like to get into those hospital beds, but there's no room because those people are there because they can't go to the state hospital, and it just goes around and around.
Right, some longer wait times in those emergency department type situations sometimes, or people looking for other options, even outpatient or other counseling and other services like that can be delayed or affected by this, according to the hospitals.
Yeah, all right. Good stuff as always. Thank you, Evan. And speaking of the state hospital, yesterday we showed you how Marion County commissioners are worried those who are released early from the Oregon State Hospital could end up on Salem streets instead of the county where they came from. And it is a valid concern. But there are worries inside the hospital about another issue, staffing. There are more than 200 job openings there, and state lawmakers just authorized $1.7 million to fund another 20 full-time positions.